Hi, everybody. My name is Erwin Loh. I'm the Group Chief Medical Officer for St. Vincent's Health Australia. I'm here to talk to you about patient selection and its importance for health system efficiency and effectiveness. So, what is patient selection? If you look at this study from 2006, it defines patient selection as the process by which a surgeon decides whether to accept responsibility for the care and treatment of a potential patient. This is something that doctors do all the time. In particular, proceduralists, like a lot of you who are listening in, you have to decide, just because the patient comes to you seeking treatment, you have to make the decision to accept the patient, whether it's through a referral or whether it's through a direct self-referral from the patient himself or herself. And this is something that's done every day. It's done from the first day we all practice medicine, but it is important because it potentially has an impact on the outcome of your treatment, the efficiency that decision-making might have in terms of impact on the health system itself. So, and efficiency, when we talk about efficiency, it's not just the numbers of patients that the health system can accommodate, because if you pick the wrong patient with the wrong outcomes or increased complications, it slows things down. We lose the capacity to treat more people, but it's also cost. Cost is a very good de facto measurement of efficiency because things that are inefficient tends to cost more. Not all the time, but there is usually a correlation. And then effectiveness, which is the other side of it, is how effective your intervention is dependent on the right patients getting that treatment as well. So patient selection is important. It's the kind of key topic that we're looking at. And in orthopedic surgery, there are all sorts of ways that surgeons select the patients. This is just a random example in terms of selecting patients who might have isolated injuries, but there are patient selection articles that looks at, ankle arthroplasty, hip arthroplasty, and all sorts of other procedures as well in orthopedics. So, because this is an orthopedic forum, I've looked at different papers looking at patient selections and different procedures in orthopedics, but you guys are the experts. You already know about this. What about then cost management in orthopedics? So there's also been quite a few studies looking at cost and how cost should be measured specifically when it comes to orthopedics. This is a review article that I looked at that look standardizing cost measurements to look at how that can be used to help and support decision making and the use of statistics and everything. So this is an area that's emerging when it comes to people looking at this as a way of understanding the link between choosing the right patients and the impact on the efficiency and effectiveness of the health system, and in particular costs. And so when people started looking at this, what kind of impacts cost might have, what kind of impacts on costs different types of surgery might have and different types of patients might have. So this paper talks about the fact that if you have more procedures done in the outpatient setting, which is now the trend, isn't it? With day surgery facilities now and people having not having overnight stays, the belief is that this increases efficiency. So if you look at the window on the screen there, it decreases costs and also lowers complications. And this paper talks about, yes, if you do more day cases, if you move cases to outpatients instead of the inpatient setting, then you're going to get better efficiency and lower costs. And is this because of the setting? So if you kind of drill down and expand that further, it is interesting. So this is a meta-analysis of current evidence done a couple of years ago around comparing inpatients and outpatients. So they found that if you compare inpatients and outpatients, number one, it confirmed that outpatients, in this case, spine surgery, there's less cost for outpatients when you do spinal surgery as outpatients. And there is reduced reoperation rates if you do it as an outpatient, and there is a reduction in readmission rates as well. So is it a setting? Now, this paper argues it's not the setting, but it's actually patient selection that's key here, that's giving us the efficiency and reduced cost. And so this is the final kind of chart. Is complication rates are also less if you do it in outpatient. So, but the paper, the meta-analysis concluded that, in fact, it is to do with the patient selection. Well, how is that? Why is that? If you look at the data, you'll find that patients who are done in the outpatient setting tend to be younger overall. And so that's a patient selection factor, not the setting factor. And secondly, if you look at those patients, there's a less incidence of diabetes as well. So there were the two kind of key findings. And so this supports the fact that appropriate patient selection is key. It's more important than the setting, it's more important than a lot of things, and it actually has direct impact on efficiency and costs as well. And then clearly on the effectiveness of the intervention. It is interesting because I found another study out of an annual meeting of the American Academy that found that actually the outcomes are comparable, although outpatient surgery can offer cost-effective treatment, but they didn't find as much of a difference. Now, the team in Opus has done research around this in terms of costs and long-term gains and quality of life. And in this case, it's total knee arthroplasty, and it found that it is cost-effective for most patients, except for those with severe osteoarthritis. So again, the selection of patients is key, and this is one of the key pillars of the Opus program is understanding where patient selection fits into this and how important it is. In another study as well, they found that patient selection is important, and patients get discharged sooner and more often go to home. But in fact, the overall direct hospital costs remain unchanged, and the cost savings were actually for the insurance providers, not the hospitals. This is an interesting finding in a US setting. But it just kind of highlights the fact that reductions in costs are complex because of the different insurer partnerships that exist. In this particular study, again done by Professor Chung and his team, they looked at how patient-reported outcomes measures or PROMs could be used for looking at cost evaluation, economic evaluation. And they found that, yes, it can be used, but the timing of when you collect the PROMs is key here. So again, this kind of highlights that this whole space of looking at patient selection, patient-reported outcomes, efficiency and cost is complex. The collection of data needs to be done in the right way, because depending on how you cut the data, you can get different results. And last thing I kind of touch on is, in terms of, in particular, effectiveness, the current COVID-19 pandemic is quite telling, because now as we, in Victoria in particular, have just restarted elective surgery, how do we pick the patients? So again, patient selection is key when it comes to reopening elective surgery. In this case, orthopedic surgery, you want to ensure that you've got the right resource, that the patient's fit, and that there is time sensitivity. And again, there are different papers on restarting surgery in orthopedics. I'm just giving you some examples here, and different flow charts. But the key here is patient selection as well. Last but not least, I just want to touch quickly on the fact that patient selection is important for your own protection as surgeons, so that they, number one, provide fully informed consent, but that they're not getting unrealistic expectations, and that you are protecting yourself by ensuring that the right patients are getting the right treatment. And last but not least, patient selection talks to the fact that it's the surgeon choosing the patient, but it can also be looked at the other way around. Patient selection could be how the patient selects the surgeon, in this case, orthopedic surgeons. Most of the time, patients don't have enough information really to pick the right surgeons, but what they want to know is information around physician or surgeon quality, whether they adhere to standards, how frequently they perform the procedure compared to their peers, and the rates of complications in your operations. Look, I'm just going to stop here, and I might take questions and have a time of discussion. Thank you all.